Good afternoon, everybody. My name is Justin Westmiller. We're here for the weekly brief, and with me is...
I'm Dr. Annette Mercatante. Hi, everyone.
All right.
Justin, could you do the data? I'm sorry, I'm not quite set up here to do that.
I'll be happy to. Go ahead. We're ready to roll with data. All right, so totals to date, 4,689 total cases with 261 hospitalized. We have 90 deaths now. That's up a few from last week, unfortunately, and we have 1,872 recovered. Now, we've talked the last couple of weeks about the recovered number being a little unreliable because there's so many cases, it's hard to get to them. Changes in the last 7 days, we have 788 new cases. We're averaging 113 cases per day, and we're also averaging about 900 tests per day. Our current percent positivity is 14.5%. So here's the ongoing curve, and as you can see, we have kind of plateaued a little bit right now, and we're staying, even though it looks like we're falling off a little bit. We're still pretty high, and we're going to remain high for quite a long time. Percent positivity of testing here, obviously since October, it's gone up pretty significantly. And as I said, we're 14+% positive right now. And then the final screen is always the dashboard link that you can stay up to date every single day. You don't have to wait for our conference here every week. You can see those numbers every day, and they match kind of what we just talked about.
And I should add, I know everyone is interested in all of our eyes as well on the hospital systems, as that is a good measure as well, and probably even a better measure of the reality of the situation, as opposed to just case counts. As you know, case counts can vary a lot based on the accessibility of testing, how well the testing is being reported, et cetera, et cetera. But there's no question that people that go into the hospital with COVID-related diagnoses are diagnosed properly and are counted probably much more accurately than in the general population. So our hospital counts, there is overall an increase in the percent of inpatients that are COVID-related. I believe in St. Clair County, what we heard was about over 20%. Varies a little bit from hospital to hospital. All of our hospitals are reporting increased activity in their emergency rooms. All of our hospitals are reporting staffing difficulties because of staff getting sick and having to not report to work. All of our hospitals have the capacity to expand beds and space for COVID or any kind of patient-related care, but you have to have the personnel to take care of those individuals as well. And that is, I would say, overall a bigger problem right now than just space. There is, without question, a growing concern of people who are requiring medical care and just how busy our hospitals are. So watching that closely and having a lot of conversations throughout the state about how we can best handle that.
Okay.
All right. So I think we'll get right to the questions.
All right. So we had some questions come in last night. So I will start with those as well as the ones that are coming in right now on the live feed as well. Okay. First question. Once I receive 2 doses of the vaccine, will it be safe for me to have more contact with my friends and family, even if they didn't get the vaccine?
I would assume so, but there's a lot we don't know yet about these vaccines. The actual data has not been released. We are not privy to that just yet until it's been approved. Efficacy of a vaccine would suggest that an individual won't get infected with the virus, although sometimes it means that they just may not get as ill from the virus. That can obviously mean 2 very different things. If you're still infected, but just not getting as ill or aren't going to get hospitalized, that's a good thing for you, but you can still transmit the virus. So we will be able to say a little bit more about that when we know a little bit more about the vaccine.
Okay, thank you. Justin, this one's for you. If the case numbers aren't going down, even with the shutdown, why can't school be in session?
So quite honestly, in St. Clair County, the major issue was the staff in all the school districts. We were losing many more than they could backfill, and it made it an untenable situation. So it doesn't really have to do with the case count per se. It has more to do with the ability to staff all the buildings properly to ensure a decent education.
Okay, thank you. Next question. My child's catechism class is still in person. She's 13. I understand that it's not affecting children as bad, but does that mean they can be carriers of COVID just as easily? What are your thoughts on in-person classes right now?
So I'll just say that there's been a lot of discussion about kids and how well they can transport. There's no question children can get infected. And there is no question that children can then spread that infection to other individuals. It is also clear that children don't suffer the same degree of illness that older individuals do. So if they do get the infection, they tend not to be as ill. That doesn't mean that young people don't get seriously ill. They can even die from this. It's just much more uncommon. So the answer to the question is children can get infected and children can spread the infection. There is no question about that. And with that, the question of should there be in-person anything, I think at this point, earlier I'd say, well, as long as we were trying not to spread the infection, in-person anything is a bad idea. If you don't want to continue to spread infection or be exposed to it, then in-person anything is a bad idea. So I think it's a bad idea. That's my, but you have to weigh that against, are you willing to get sick? Are you willing to maybe have the infection and give it to somebody else and not know it? If those things are more important to you than the potential of making somebody else ill or getting ill yourself, then that is apparently your choice to make in our society. Do I sound a little, upset? I kind of am, but that's where we are, people. That's where we are.
Now, you already covered about the hospital capacity and such, but Justin, how are we doing on supplies such as ventilators, testing equipment, and PPE?
So we're aware of the number of ventilators in the county. It's right around 50 or so. We have approximately 25 or so in use right now. But the good news is we can get our hands on more if the hospitals tell us it's time to make that order. So ventilators isn't our biggest issue right now. What we're really starting to struggle with is the access to certain personal protective items such as gloves. We have the ability right now to partially stock our hospitals, but they are keeping a close eye on all the stocks for nitrile gloves. And the reason for that is the nitrile is made overseas and many of those plants are shut down or slowed down. So that's kind of where we are right now.
Okay. And I understand that's a worldwide concern
It is.
of gloves.
It is.
All right. So this person asked, how do you come up with a number of recovered cases?
Well, the state does it by, and I wish I had Brandon near me. The state does it by looking 30 days beyond, and then the people who haven't died are considered recovered, something along those lines. We have traditionally and locally, until we couldn't, is we would call people, remove them from isolation, and know that they've recovered because we spoke to them and we would take them out of the system. And obviously, that system has gotten a little bit backed up. And so there's probably a lot more people who have recovered that are unaccounted for. Going back to a system like the state's using might be a fallback, and that's probably why the state's doing it. So just looking backwards 30 days. And of course, people do die from COVID beyond the 30-day mark. So even that's not a perfect way, but it's a good way of estimating. And I don't think there's a greater or lesser percentage of people who are recovering. I think there's the same proportion of people who get sick are going on to get hospitalized. But I think what's happening is there's a much greater number of people who are getting sick, so that proportion is bigger that are needing more care.
And recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset.
Oh, okay, thank you.
Or referral date if onset is not available.
Okay, but still for our system, somebody has to physically go in there and remove those names and kind of physically, mechanically change the data surveillance system. It just doesn't automatically happen. It's not pre-programmed. So that requires staffing and time. And our staff has been prioritizing investigations that could impact further spread. So I still think that issue, I'm going to go back to numbers and what do the numbers mean. When you're looking at number of recovered, you should be kind of trying to identify, are more people dying than should be, or are more people getting sick than should be? And you use that kind of data to guide that decision. And I can say statewide and locally, we don't have a sense that more or less people are recovering than should be. It's pretty much along the same lines it's been all along.
Okay. All right. Next question that came through last night. Are testing centers allowed to charge a fee for the COVID testing? And how and where can a person get a COVID test in St. Clair County?
Yeah, I'll take this one. So yes, they are allowed to charge a fee. It's not necessarily free. And you can find testing locations not only on the St. Clair County Health Department website, you can also find it on the state of Michigan coronavirus website. There is a link to the list and the ability to find them in both places.
Yeah, and on both of those sites, you can filter your search, not only but how far away, but you can filter your search by whether or not you need a free test or not, or even whether you have a doctor's order or not. So that is there for you to look at.
Okay, this person had made a comment on our page about trying to get through to the health department to make an appointment for a COVID test, and they didn't get a call back. So can you just remind people that we
go online?
Yeah, go online. They can leave a message. We'll return their call normally within the next business day, but normally they'll probably get a call within the day. Okay. Is there a new mutation or strain of COVID going around?
We must answer that question a million times. The virus itself being a RNA virus in itself means it's going to mutate all the time. But no, there has been no significant mutation that we're aware of that's drastically altered the overall pathogenic qualities of the virus. In other words, how it infects us or how it makes us ill. There was a shift, I think, early on in the pandemic when it was spreading worldwide, but I believe most experts have looked at that and feel that there's basically the same virus worldwide that's impacting all of us, and that it hasn't changed dramatically. They also don't think that the shifting is going to dramatically change the impact on the vaccine, but of course that remains to be seen.
Okay, someone mentioned if it's the cold weather bringing this back, like you guys say, then why are the numbers going up in Australia now when it's their summer?
It's not the cold numbers, it's what we do. Okay, go ahead.
Mm-hmm. Yeah, I'm just trying to help, Doc, because I know, so a couple of things there. Number one, Australia is a rather closed society, and their numbers aren't going up exponentially. They aren't by any means runaway. They've actually opened many of their areas that were closed for travel to each other. And I know that because a personal friend of mine who runs an emergency operations center down there just emailed me last week and said, hey, we're doing a lot better than we were earlier, even though the case count's on the rise. So the difference here is we've got a lot of things happening. One, it's colder out, so everybody's going inside. And when you go inside and have close contact, this virus spreads through respiratory droplets, like we've said many times. And so people are in close contact, and it is happening for a couple different reasons. One, we have pretty significant or major community spread at this point. And when that happens, the way this virus works is the first 1 to 7 days, you may not have any symptoms, but you're perfectly able to pass it on to others. So there's lots of different factors, but being inside in the cold weather is certainly not helpful in any way, shape, or form.
And I'll just add, and I think history will bear this out, some of the preliminary data looking at different countries and different governmental responses to the virus are obviously not all finalized, but there is definitely a pattern to be seen with restrictions of motion or mobility, restrictions of individuals' ability to move around, restrictions, mask mandates, things of this nature, and the impact of the virus spreading. There is a strong correlation between strict strategies like masking and social gathering reductions and a reduction in the virus. And of course, across the world, there have been just all kinds of variations on this theme. And when all the dust is settled, we look at that. I think we'll see that the countries who took the strongest response initially probably had the slowest rate of viral transmission, at least at the beginning. Of course, every time you try and open up, the same thing happens, right? So every time you do well, and then, okay, well, let's get back to business, and then we'll see, we see the virus spreading again. That is happening throughout the world.
Okay. The next question, though, these are coming off our feed now. Please help us understand the logic of closing restaurants. Millions flew last week and packed into big box stores.
I'm going to let Justin kind of morph on this a little bit, but I can tell you that the data that the state looked at, they tried to look at where, not all, but at least where some of the bulk of exposure could be occurring that they could actually have some impact on. That's why they chose high schools over grade schools. That's why they chose bars and restaurants over retail businesses, because there was just data to support that there was more transmission of infection in those venues than in others. And rather than just take a hammer and block it all down, they tried to just kind of tease out the higher risk areas. Whether that will work or not, whether it's fair or not, I can't tell you. But I do know that they tried to do it based on what the data was showing. Justin, you have anything to add on that?
Yeah, as far as the travel over the weekend and people shopping for Black Friday, we haven't removed anybody's civil liberties, right? The CDC and all the states that I know of put out serious warnings saying this is not good and don't do it if you can avoid it at all. And we still had the biggest air travel day we've ever had in this country. So it's all about personal choice right now. If we want to limit this, we need to do the things that we've been talking about for the last 9 or 10 months. And that's all the COVID protocols. Go ahead,
let's talk about our numbers. So Justin showed you how we plateaued, how we're plateauing in the last 5 days or so. And these numbers tend to follow by several weeks, whatever happened. So the beginning of November, we were seeing a lot of compliance with masking and distancing. And I think following this weekend, we're going to see another surge. I hope I'm wrong, but I would expect to see our numbers go up. But not right now. We're going to see it in a couple weeks from now. And then just as we're getting over that, we've got the Christmas holiday to deal with as well. So if people just keep doing what they want to do, despite the strong recommendations and advice from the experts, we are going to have to continue to deal with the repercussions of it. It's just as simple as that.
Someone mentioned at the top of the show, why do you say we are going to remain high? How delayed is the data?
It's not the data. Well, the data is behind, it's real-time data. It's behind maybe a few weeks, a week, 2 weeks, 3. It depends on where you pull your data. But it's behind because the virus, when it transmits, takes up to 2 weeks to manifest itself to make a person ill. And then in those cases, it often takes a person a few days then to get tested. And then those tests have to be put into a system. So the whole process just takes a little while to become apparent to us in a surveillance type system. It's just the way the virus works in our bodies. The surveillance piece, the data piece, is just going to always lag because that's how our system works. We do not have an integrated system. We do not have a unified single data reporting system or extract. Every county reports it to the state. Every state does it differently. It's all just going on out there, people, and we're doing the best we can to pull it together.
Okay, the next question we received a few times. Are we going to completely shut down?
So
politically, go ahead.
Yeah, I was just going to say the same thing. Politically, they're basically unable at this point in the state of Michigan due to the fact that the Supreme Court made the ruling on the previous emergency declaration. We would have to have something happen significantly different for the governor to enact another emergency declaration, and we're not seeing anything significantly different. So as far as is a shutdown looming, I would say no, there's no authority to do that. Now, does MDHHS and MIOSHA and other groups like that, do they have the ability to issue additional rules or additional policies? Yes. So a full-scale shutdown, no. But could we see changes to the MDHHS rules and the MIOSHA rules? Yes, absolutely.
Okay, this question is about mask mandates. Can a private business enforce a mask mandate within their property for their employees?
Yes. Well, actually, let's face it, masking is a requirement when you're out in a public place, including businesses. So it is the business's responsibility to enforce it. Okay, but it's already a requirement. Legally.
It's already a lawful requirement, right?
It's a lawful requirement legally. The issue is, how do you compel people to comply with the law, including the ones that we have, not to mention if we wanted to go stricter. And the bottom line is Americans, the United States citizens, do not want to be told what to do. And unless they choose to do it themselves, we're not going to see it happen, I believe, unless we fall apart to the point where we have some kind of a real change in our, our system. I would hope and pray that as people around you fall ill and you see things happening in your environment that are becoming a greater and greater concern, just open your eyes, talk to people, put your social media away and look at real resources. Okay, people, this is going to impact everyone. And that by that, you will make a choice not to put yourself and your loved ones in danger by going out. That is unfortunately what's going to have to happen.
All right, the next question is on the hospital. I just heard Port Huron McLaren is only taking priority 1 patients. Is this because of staffing or COVID?
No, it's not staffing. They are actually at capacity. They're actually beyond capacity right now as of 3:15 today. Now, what that means for everybody out that may not know what priority 1 patients are, that's basically your life-threatening patients. So they are still accepting those into the ER, but everybody else is being either sent to other facilities or dealt with in a different way.
And I'll just also add the question, is it COVID or staffing? The answer is both. The staffing is a problem because of COVID. So what came first, the chicken or the egg? It's COVID causing the staffing issue.
All right, the next 2 questions are on vaccines. Is St. Clair County prepared to receive the COVID vaccine with its challenging storage issues?
We will be. Yes, we will be.
Okay. The next question is, I have a very low immune system due to chemotherapy. How confident can I be to take one of the new COVID vaccines? Don't you need an immune system in order to build immunity to COVID?
Yeah, we would have to have a little bit more information to answer that question. Those people with special medical and immune system issues, we would have to look at the phase 3 trials and see exactly what they tell us about that. It would be my thought that special circumstances like yours, you would not be in the first line of receiving this vaccine. You would have to rely on other people around you receiving the vaccine to reduce your risk. This is why it's so important. Other people getting vaccinated for those who cannot is going to be a very important concept.
Okay. This person wants some clarification on the question the person had about the catechism class. So are you saying that in general, in-person learning is not a good idea? Yes or no?
So some of our schools are still doing in-person learning, and they're doing well. No, they're not reporting any difficulties. And if that's what's working well for that institution, great. I would hope that they're doing it with the utmost caution, including making sure that there's ample distance between participants, everyone's wearing masks, making sure that nobody is entering who's already in quarantine or sick. There's all these factors that can make in-person learning less risky. Okay, it's up to you to decide if that risk is worth it with that particular situation.
All right, she had a 3-part question covered it all too.
Yeah, and if I could jump in too, we've always been talking about this. We would know that when the threat level was starting to get much higher is when our hospital systems are full. I will tell you that the hospital systems around the state of Michigan, they are filling up fast if they aren't already full. So that should be a huge star for everybody to say, hey, listen, maybe we do have a problem here. Maybe we need to take some personal action.
Okay. Can someone have COVID and not a fever? Can someone have COVID and still have their taste and smell?
Of course.
Yes.
So that's funny that my partner was just asking me that question too. And we both had COVID this week. I'm recovering. He's still pretty sick. We had similar but different symptoms. Not everyone has fever. Not everyone has taste and smell issues. Not everyone has the muscle aches. Human bodies respond differently to the same virus. So yeah, your symptoms can vary quite a bit. And there's no way of predicting that.
Or you can have no symptoms at all, right? We know
you
of
can
many
have no symptoms.
asymptomatic patients. Yeah.
Mm-hmm. Mm-hmm.
So why is everything COVID? Couldn't it be the flu, a sinus infection, or the different
Everything's
types of
not COVID. So people still do have sinus infections. They still do have allergies, but they don't die from that. Well, I guess you could. You're not going to die from your allergies, but you can still get pretty sick from a sinus infection. My point is, COVID hasn't eliminated everything else. We still have, and this is what the problem is right now with our hospitals being so overwhelmed, is because all these other things are still going to happen. They haven't gone away, but we just have this other big gorilla now on top of it, sucking up all the resources and sucking up all the energy out of the room, and it won't be ignored. It won't be ignored. So flu season has not hit us yet. I can tell you I've been hearing reports of flu testing being positive, but statewide we are not seeing a lot of flu activity. Whether we will and when we will remains to be seen. That's just going to add to the overall burden of everything else if we do see it.
But they are testing for flu. That's something we hear also. Are people doctors testing for flu? Are they testing?
Yeah, and they'll still consider sinus infections, and they'll hopefully still be looking in your ears to make sure you don't have an ear infection. Those conditions will still be there. They just have to be differentiated now from COVID. And any infection can look a lot alike. That's not always an easy task, especially viral infections. They can present very similarly. It's kind of hard to tell them apart sometimes.
Okay. Does St. Clair County have access to the life-saving medicines and antibody plasma? And if so, are they using these medications as needed?
Convalescent plasma has not been shown to be very effective. Remdesivir and some of the other monoclonal antibodies we are receiving and using as appropriate.
Okay, what should somebody do if the businesses is in their area are not requiring masks, even of their employees?
Well, first thing I would say is go ahead and submit your complaint through our website. Complaints need to be validated. And as one of the harder things we have to do, we're not going to try and enforce a non-compliance issue without some kind of validation for the business. We prefer businesses to be compliant voluntarily. So that call will be made, and if we need to pursue it further, we will. The real question, though, is what do you do if you walk in someplace and the business isn't wearing a mask? And my advice to you would be to turn around and walk out and do not give that business your money or your time. Don't risk your health over a business that's not taking your health personally or not taking it seriously. You do have control over that. You know, you have control over where you go. And if you see things that you don't feel are in your best interest, turn around and walk away. Go somewhere else.
Okay, the next couple questions are, I'll just combine them, but they're about Mercy Hospital or Lake Huron Medical Center. Like how somebody had the question about McLaren. So these people want to know, how are the Lake Huron or Mercy Hospital COVID numbers? And are they at capacity at the hospital?
So they are not at capacity, but they are getting closer and closer every day. And, you know, as it could be a cascading effect, one hospital can be full. They'll transfer all the patients to the next hospital. We'll fill that one up, and then we'll be on to the next one. So that's kind of where we are right now. We know we've got one with a very high volume and one with a moderately high volume, and then one with a moderate volume. So that's what we're working with.
Okay.
And we are working together, and we are talking together, and this is being paid close attention to. I want people to know that.
So the next question is, will the vaccine be mandated for all healthcare providers?
So I'll take that one too.
So.
No.
Go ahead.
Yeah, it can't be during emergency use authorization. There's no mandating allowed because it's not. It hasn't been fully vetted by the FDA. So in this initial rollout, it's under an EUA, and people have to be willing to take it.
All right, this person wants you to reinforce, and you both probably could do this, or one or the other, reinforce about the comments you made earlier about if people don't comply with wearing masks, if they don't socially distance, if they still gather, how this is going to cause more businesses to close and overwhelm our healthcare systems. And then what happens when our hospitals are full? I don't feel people understand the consequences of their actions.
I don't think they do either. Justin, give that a shot.
Yeah, I mean, you know, we've said it over and over and over, right? The COVID precautions work. You have to actually do them, though. So if you're not willing to be away from other people, if you're not willing to sacrifice just a little bit right now and follow the COVID precautions as prescribed, then we're going to continuously be in this vicious circle. We know that there's an opportunity for the vaccine to come out and help with this, but it's still gonna take work from all of us to make sure that we have the best outcome possible.
And what does it mean? Let's talk about that. What does this mean? And I'm going to just kind of lay it right out here for you guys. It means pain, and it means suffering. It probably means excess death, okay? Because things that you would normally consider routine are not going to be routine anymore. It's not going to be available. It is going to be a limitation of resources, and you don't really appreciate that until it's gone. I'm going to just go back to my personal story about just being sick for the few days that I was over the holidays, unable to feed myself, unable to get fluids for myself. I'm fortunate. I have resources, and I have people who care for me and were able to support me. What about those people who don't? Think about what will happen to them. being sick for 3-4 days, unable to care for themselves in limited settings. Normally, you might call 911 and they'd take you to the hospital and they'd clean you up at the hospital, and they'd call, they'd call a social worker and they'd come out and they'd find support, figure out where else you. That's not going to be available. Those things cannot happen when the hospital's prioritizing doing priority 1 and only taking care of people who are critically ill and are having trouble breathing, or have been in a terrible car accident or something that is immediate life threatening. So there are down the hill repercussions that are going to impact our long-term outcomes, but short-term is going to be pain and suffering. And it's going to be loss of business and revenue, because sick people don't shop and they don't work, and they certainly can't run a business.
So somebody else shared that they also had COVID really bad, and they wanted to know how long before they can get their smell and their taste back.
It's hard to say. That smell and taste thing, those are very sensitive nerves. It can last for some time. I really have not seen the literature to give you an accurate answer. I hope it comes back. It could be months. It could be a long time, quite honestly, for something like that. But I hope it does come back for you.
So we circled back to some hospital questions again. What is the percentage of inpatient in Mercy and McLaren COVID compared to non-COVID? I don't know.
I don't have that data in front of me. I think they're all above 20%, though. If I had to, pretty, isn't it above 20%? Okay. It's above 20 and below 30%.
Brandon actually can answer, Doc. Go ahead, Brandon.
Okay, go ahead, Brandon.
It's above 25% at both hospitals for the most data that we have.
Okay, thank you, Brandon.
But under 30%, right? Still?
Correct.
Okay.
Yes.
So this person wonders, are the temperature checks that you do when you go into certain places pointless?
No, they're not pointless, but they're not a guarantee for anything. As I just said, you can be sick with COVID and not have a fever. You can be sick with COVID and not have any symptoms at all. So temperature checks and symptom checks are a tool to reduce the burden, but in no means is it going to eliminate. Okay, I went from my home to my office, and we have in the health department very strict mitigation strategies. You don't walk in the door without a temperature check. You sign in that you've had no symptoms. You wear a mask anytime you're in the building. Nobody goes near each other. I still got sick. Okay? This virus looks for any opportunity it has to go into another body. It is its whole purpose in life. In its cycle is to just infect other human beings. So no matter what you do, if you're out there, there's a risk to you, and people have to understand that. There is no panacea. And even when we get the vaccine, it is going to be very important for people to continue to wear their masks and do the social distancing until we have this demon under control. We have to use all of our tools, or it's going to just devastate us as a community.
So, Doc, this would be for you. This question came in last night. Do I get my money back for my health inspection? That would be the license, I believe.
For the restaurants, we did talk about that. And there is honestly, no discussion. And I understand. First of all, let me say I understand there's a lot of injustice in all of this. There's a lot of losers in this thing. Probably all of us, perhaps at some level, are going to be losers in this game. But when it comes to reimbursement of licensing fees, there is no current discussion about that. No, now. And I hope that we can come up with some compromise to support our businesses, including our restaurants, to try and get them through this difficult time.
All right. The next question is about Christmas. Is the only truly safe way to celebrate Christmas to be only with the people that live in your household?
Yes.
Yeah.
Yes. Unfortunately, that is true.
Somebody wants to know, if you have had COVID, should you still get the vaccine?
Yes. There's a couple reasons for that. We don't know what natural immunity is after a natural infection or how long it will last, nor do we know that everybody who thinks they've had COVID have had COVID. We know that the tests aren't perfect. We know a lot of people have COVID-like symptoms and aren't tested. So it would be just too difficult to, and I got to tell you that in general, that's how we immunize when we're trying to eliminate or suppress a transmission like this. You vaccinate as many people as you can, regardless of their history of natural infection or not. And it works.
This person asked, is one still a carrier of COVID if they have the antibodies or eventually the vaccine?
We don't think the virus, we don't know for sure, but we don't believe the virus stays dormant in our bodies and continues to be infectious over a long period of time. That's why we have the 10-day window after an acute infection. We believe most people, not all, but most people are no longer infectious after 10 days. So the virus is not dormant. The antibody response, your immune response, kills the virus or suppresses it from entering into our cells so that it loses its. If a virus can't replicate inside our body, it just dies off. It just goes away, and moves on, right? So that's its life cycle. So the question of the immune system suppressing it doesn't mean that the virus just gets weakened and sticks around. It means it weakens it at the point where it can't infect our cells anymore, and it just disappears from our bodies. We get rid of it.
So the next person says that at her work, they have around 12 to 13 people who are positive, and she feels that she's been exposed. Does she wait to see if she loses her taste to get tested?
No. Again, don't rely on any one symptom. Even a very mild symptom like a stuffy nose, a headache, a scratchy throat would warrant you getting tested. What you should be doing is assume your exposure is putting you at increased risk of having an infection, and you should be quarantining yourself. You should not be in the company of other people who could get infected by you before you know you're sick. Some people, remember, don't even get sick, and this virus is very clearly spread before symptoms can even be noticed. So if you think you've had an exposure, your best bet is to quarantine at home for 14 days. Okay, from the last date of your exposure. If a full 14-day quarantine is impossible for you or unacceptable and you need to return to some environment, then getting tested somewhere after the first 5 to 7 days is probably a lot smarter than rushing out and getting tested on the first 1 or 2 days. Very few people are going to show positivity after the first couple of days of an exposure. Your body does take a while to generate the viral particles enough to be detected. So a test at 5 to 7 days, if negative, doesn't mean your quarantine should be eliminated, but it does add a little bit of security if you're forced to go out or have to do something more. And then at any time during that 14-day period, if you get sick, any kind of illness, my suggestion would be to go ahead and get yourself tested.
All right, this question is about McLaren. Is this true or false? I just heard Port Huron McLaren just closed to no new patients.
No, that's false. So, like I said earlier, they have temporarily closed to anything other than a priority 1 or a life-threatening situation, and that's just because they've reached they're above capacity right now.
Another McLaren question.
Go ahead.
Do you recommend outpatient procedures at McLaren right now?
That is a question that each hospital has to decide based on their internal capacity. And we know that other procedures result in, or the lack of doing other procedures results in unnecessary and undue problems as well. So each hospital is going to have to decide.
Lost Doc there. Lost all sound.
So I'm sorry. So what she was saying was basically the hospitals have to make their own decision, and I would follow up with your doctor to find out what his or her recommendation is on your upcoming surgery.
Thank you, Justin. We lost Doc there for a minute. I don't know if Doc's back on, but somebody wanted to know if she took any of the approved COVID meds.
I'm not sure it would be appropriate to speak on what she did with her personal health, but I will tell you that she is feeling better today. There she is. She's back. But she's feeling a little better each day, and we're awful happy about that.
Talking about my COVID experience.
about you.
And some
Yeah.
people,
Yeah.
I did not have a good time with it. It can be a bear. I know some people have mild infections, but it can be pretty brutal. It's nothing to take lightly, and nobody's exempt. Nobody's exempt. I consider myself a healthy person, and I'm under the age of 65. So please take this seriously.
And a lot of people are sending you well wishes.
Yeah, and the question was, what medications and things did you take? And I basically said, we weren't going to discuss your private medical history. That's
well, I will say that there is currently no evidence to support any medications in an outpatient setting. A couple of the monoclonal antibodies have been approved for specific populations in an outpatient setting. Those are still not easily accessible. I'll be honest with you. I hope to see a little bit more of that, but even the research on those is very limiting. So unfortunately, if you get sick with this virus, it's care and comfort, it's fluids, it's rest, it's Tylenol for the high fevers, and just the normal things you have to do. There is not an antiviral available at this time that we know is effective. And thank you for all the well wishes. I appreciate it.
We are caught up on the questions, but Doc, I don't know if you have in front of you. They wanted to promote the 2 upcoming flu clinics. Do you have that information in front of you?
Oh yeah, I did.
It's not. I do. If you don't.
Yeah, why don't you go ahead and tell them, John? I'm sorry, I had it written down. I don't see it anymore.
So there are 2 upcoming flu clinics. One is going to be on Monday, December 7th from 2 to 6 p.m. at Algonac High School. And you just need to register at www.scchealth.co. It's open to students, faculty, staff, and community members. And then you can also get childhood vaccines available to anyone 18 and under as well. Just want to register. And there'll also be a drawing to win an iPad at that particular one. And then we also have another community clinic at Teen Health in Port Huron on the campus of Port Huron High School, 2215 Court Street. And that's Saturday, December 12th from 10 to 1:30. And that is, again, flu vaccines available for students, faculty, staff, community members, and then vaccines for anyone 18 and under will also be available. And again, another chance to win a free iPad. So if you're interested in those, go to our website and you can pre-register for those. All right.
Thank you.
So we are done. So if
my
you want
closing
to do
comment. Yeah, I'll do mine. I just want to thank everyone for the well wishes. Help each other out. It made a huge difference for me. Friends going shopping for me and leaving it on my front porch. Things like that make a huge difference. So help each other out. This is the time in our lives where those little acts of kindness can literally save lives. So please do that. And as far as hope, we have hope. We have a great deal of hope. Science is going to save us. I really believe that. The science of the technology of these vaccines is absolutely remarkable. So those naysayers of science, all I can say is it is the knight on shining armor that's swooping in to help us, and we have to trust it and we have to believe in it. And we'll give you all the help along the way we can to do that. Justin?
Thanks. So we are reaching a point in our community where it's a certain type of critical mass. Obviously this is really the first time we're talking about our hospitals being at or near capacity. And that is troublesome for the response in our community. I'm just begging everybody to do whatever you can to reduce your contact, follow the COVID protocols. And I hope everybody had a wonderful Thanksgiving and are looking forward to the rest of the holidays. They may look a little different this year, but every little bit counts. So I thank you all for everything you do in the community. And I think we'll see you next week.
Next Tuesday.